Great.
So I want to welcome everyone to the Infection Prevention and Control webinar for COVID-19 and people with disabilities. My name is John Massa. I work for the Center for Independent Living in Toronto, and I am the Independent Living Skills Coordinator. And we're joined today with Timothy Valliere, owner of Integrity Care Consultants, and my co-facilitator is Rebecca Wood, the CILT Peer and Parenting Program Coordinator. Just to describe myself, I'm a person with a physical disability. I have very short black hair and a short mustache, and I have a physical disability with complex care needs. I use the pronouns of he and him, and I want to welcome everybody for joining today. So although this webinar is happening virtually, we are located, CILT is located in Toronto, and we would like to begin by acknowledging the land on which we gather is the territory of the Haudenosaunee, and most recently the territory of the Mississaugas of the Credit First Nation. The territory was subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and the Allied Nations to peacefully share and care for the resources around the Great Lakes. This territory is also covered by the Upper Canada Treaties. Today, the meeting place of Toronto is also home to many Indigenous people from across Turtle Island, and we're very grateful to have the opportunity to work in the community and on this territory. I just want to check in with the captionist. Am I going at a okay pace?
Yeah, you're going fine. Thank you.
You're welcome. Okay. So some workshop guidelines. We will be recording the Zoom workshop and the questions and answers section so we can share it with people with disabilities and our allies. The workshop is content heavy, but it's meant to empower you with information and resources. For privacy and time management, everyone will be muted and no video except for the hosts. If you have a specific question or comment for the facilitators, please ensure you type it into the chat box, and Rebecca, my colleague, will ask it during the questions and answers section. Your question and comment will be anonymous in the final recording. If you need additional support, please select Rebecca in the chat box and she will assist you. We want to co-create a space that everyone will feel heard and respected, and therefore we reserve the right to remove anyone from the webinar who doesn't follow these guidelines that I've just mentioned. So the workshop agenda, we've done the welcome, land acknowledgement, introduction, which roughly took about 5 minutes. The guidelines, which I just discussed. I will be discussing the workshop objectives, and Tim will do the presentation for about 50 minutes. Then we'll have about questions and answers for about maybe 30 to 50 minutes. And the last 10 minutes will be resources and an online evaluation and thank yous. So as a workshop disclaimer, the PowerPoint presentation is for general information purposes only. The information is current as of today, February 26, 2021. The information given is subject to change depending on possible policy, regulation, or law changes in Ontario. For the most current information, participants should check the Government Ontario website and other websites mentioned in this presentation. This presentation is a property of Timothy Valliere, owner of Integrity Care Consultants, and neither whole or part is to be circulated without his express consent. And his contact number is 905-895-0000. 0842. This workshop is based on Ontario IPAC practices. So the workshop objectives, there are 6. First is talking about the importance of infection control. Second is routine practices to prevent infections. Third objective is what causes and how to prevent the flu and COVID-19. 4, the importance of personal protective equipment or PPE and the different types of PPE and how to use it properly. The 5th objective is questions and answers. And the 6th objective is resources. So just a little bit about CILT, the Center for Independent Living in Toronto. We are rooted in the Nothing About Us Without Us disability rights movement. CILT is a community-based resource center run by people with disabilities, for people with disabilities. We work towards building a society where people with disabilities have social and economic equity. Our core programs assist people with disabilities to take control over their lives and live independently in the community. And we have core programs which are information and referral and a volunteer program, peer support and a parenting with disability network program, my program, which is the independent living skills training program. Then we also have the Attendance Service Application Center, which is specific to Toronto. And then we have the direct funding program, which is for the province-wide for Ontario. CILT believes in the independent living philosophy, where people with disabilities are seen as consumers who have the right to examine choices, make decisions, take risks, make mistakes, and take responsibility for one's own life. So a little bit about our presenter today, Timothy Valliere. He is the owner president of Integrity Care Consultants. Tim began his healthcare career in 1979. He's a healthcare educator. His experience includes development and operation of independent living and outreach programs for people with disabilities and seniors, development of a nursing and home care service agency, and sales and marketing development and implementation. Tim is also an operational director for our home care branch. And I'll pass it on to Tim.
Awesome. Thanks so much, John. Welcome, everybody. So just one addendum to that introduction. I don't do the home care branch anymore. I should change that slide, John, sorry. But I work as a palliative care nurse in the pediatric hospice in Toronto. And I also work in the inpatient cancer unit at Southlake. And I'm a high school teacher teaching the PSW program in high schools. So thanks, guys, for joining me. This presentation is all about you guys. So I'm hoping that I can clarify some misunderstandings and provide you with some information that will be helpful. So everything is referenced. So again, please put any of your comments in the chat and we'll get to those at the end, but there are lots of references within the document. So what we're going to talk about is infection prevention and control, or IPAC. And what the whole philosophy behind that is, we want to prevent or reduce the risk of people getting germs for staff and other people. So the big word is the P word, prevention. In order to have good prevention, what we need to do is operate from a minimal risk with a predictable outcome philosophy that is based on risk assessment. And risk assessment, as we all know, is all based on individuals and how people choose to do risk assessment. Every agency will have a risk assessment protocol that they follow. And as clients and consumers of services, you want to make sure that people are following those. Next slide. So some statistics of the nearly 56.9 million deaths worldwide in 2016, and stats come out about every 5 years. So it's hard to get up-to-date stats that are less than 5 years old. Infectious diseases account for more than 17 million, or 1 in 3. Respiratory, which is what COVID-19 attacks our respiratory system. So in 2016, 3 million people of that 17 million died from respiratory infections alone. The flu causes about 12,200 hospitalizations in Canada each year and 3,500 deaths in Canada each year. When I did this workshop back in November, according to Johns Hopkins, there was over 54 million COVID-19 cases worldwide. That is more than doubled since doing this workshop. So we're more than doubled now. According to the World Health Organization, though, to put it into perspective, 1 billion people annually get the flu worldwide. So in our region, where I follow it statistically, our flu cases are much lower, and I think the incidence is because people are not congregating and the flu is not passing on to other individuals. So what we do with good infection prevention and control is we help to reduce the risk of transmitting microorganisms, and a simple word for that is a germ, to yourself, your attendants, your family, your friends, others in your community, and others in the world. And not everybody is going to wear a mask like they're supposed to and follow good IPAC principles. So we really want to be diligent ourselves, especially if we have ongoing health conditions, to try to keep ourselves as healthy as possible. So a microorganism or germ is very small. It can living plant or animal. It can only be seen by a microscope, and germs are absolutely everywhere. Some germs cause trouble and some germs do not. So when we have trouble from a germ, we call that a pathogen. When we don't have trouble, we call it a non-pathogen. So there are basically 4 types of germs. Bacteria are one-celled microorganisms. So you could have a bacterial pneumonia, for example. Viruses invade living cells. So COVID-19 invades our cells and replicates quite rapidly. So it's an example of a virus. Fungi is an organic matter, such as plants or animals. And the most common fungi infections that we get are thrush infections, or yeast infections. And parasites are things like worms that they live inside of a host and take nutrients from the host. So when we want to think about and put it into perspective about germs, so we don't all get so afraid, is a typical person's hand can carry anywhere from 10,000 to 10 million germs. Some are supposed to be there and some are not supposed to be there. So the resident ones live and grow normally on our skin and they protect us. They're much more difficult to remove. The transient or bacterial germ type of microorganisms are more easily removed. And according to the World Health Organization, the best way to do that is by hand hygiene. And we're going to talk about the various types of hand hygiene, protective personal equipment, and we're going to watch some videos. And then I'm going to walk people through as well from a didactic presentation perspective. Problem with germs and microorganisms is some people are infectious and show no symptoms. So they're asymptomatic is the word that we would use. And or they sometimes we use the terminology colonized. So MRSA is methicillin resistant Staph aureus, which is an example of an infection that is very prevalent in our healthcare community. And statistically, 75% of people who receive healthcare services on a routine basis are colonized or have MRSA. They don't know because they're asymptomatic and they don't have any presentation and their body is healthy enough and they don't show any symptoms. 25% of healthy healthcare workers, so a nurse like me, a PSW, or somebody you have caring for you, 25% of healthcare workers who work out in our broader community are also colonized with MRSA. So often if you have to go to the hospital for a surgery and you're in either of those 2 groups, they will ask to do an MRSA swab prior to make sure that we're aware of if anybody is colonized. So continuing on with trying to not fearmonger anybody about bacteria and germs and getting sick, if we think about a baseball field. So a baseball field, the entire baseball field would be your own immune system. That's if you're a healthy individual, you don't have any current health conditions, no ongoing conditions, no comorbidities, like, diabetes, Crohn's, colitis, lupus, all of those types of things, heart disease, lung disease. If you've got a strong immune system and you look after yourself, so you eat properly, you rest properly, exercise, de-stress, which I know is a really hard thing to think about now during our year-long COVID battle, but your immune system would be the size of the whole baseball field. A bacteria that would attack you would be the size of the pitcher's mound, and a virus that would attack you would be the size of the baseball. So if we do everything correctly, that's looking after ourselves, using proper PPE, following all of our guidance documents that are produced by public health and/or institutions like a school, if we follow all of those and keep ourselves healthy, we hope that that virus and that bacteria does not make us ill. So some of the other healthcare infections that we see out in our community are urinary tract infections. ESBL is a very predominant urinary tract infection that's going on in our communities right now. Respiratory, especially this time of year, colds, pneumonia, bronchitis, the flu, nausea, vomiting, and diarrhea that come with our gastrointestinal issues. And then the big one is open skin. So what we want to really think about is the transmission of bacteria and viruses is when it gets into our body. And how it typically gets into our body is through our mucous membranes, which are on our face. But it also gets into our body when we've got broken skin. So again, it's important if you've got broken skin or your care support individual has broken skin, that you should be wearing gloves so that we're not transmitting and making each other sick. So because of all the issues that we had post-SARS, there's a new renewed emphasis on infection prevention and control. So Hep C, HIV and AIDS, avian flu, H1N1 virus, SARS, and now COVID-19. So, excuse me, when we think about those types of things and other antibiotic resistant organisms like MRSA, VRE, those types of things, what we really want to do is, again, go back to that very first slide where we talked about minimal risk, predictable outcome, and that is all based on something called prevention. We want to make sure that we prevent as much as possible the transmission. So I'll go back to post-SARS at what one of the big learnings from SARS, which has helped us with COVID-19, is something called aerosol generation medical procedures, or AGMPs. And an example of an AGMP would be somebody who has a trach and I need to do suctioning in that trach. I would need to make sure that I wear an N95 mask, which is a special type of mask that we're going to talk about, that would make sure that those little tiny aerosolized droplets that can easily get through a regular type of surgical procedure mask 1, 2, and 3 level is stopped by an N95 or a special mask that you need to get mask fit tested for. So the learning post-SARS was that surgical masks were fine, but once you started to create aerosols, those little droplets became much smaller, much finer, and stayed in the air. You needed a much better mask. So that was a learning, and that's one of the things that we are doing now with COVID-19 is making sure that anytime we're doing an aerosol generating medical procedure, AGMP, that the staff person is wearing full PPE, including an N95 mask. So how do we keep ourselves well? We need to break the chain of transmission. The chain of transmission is how infections spread, and there are about 6 steps in this actual train of transmission. So let's talk about all 6, and John will just sort of pop through as we go through this. So we're going to start with the first one, which is an infectious agent. So an infectious agent could be anything that's a bacteria like TB, strep, food poisoning, a virus like the common cold, SARS, COVID-19, a fungal infection like thrush. That needs a place to live, so let's talk about COVID, and COVID is living in my respiratory system. So the reservoir, which is the second chain in our image that's going on the slide now, is people, water, food. How do I break that? By controlling my environment, making sure that I clean up appropriately, making sure that when I'm preparing food appropriately, I'm not mixing raw with cooked foods. I'm making sure that our water treatment, so obviously in Toronto and where we all live, the water treatment is fine, but we know that there have been issues and water treatment deficits that have caused illness and death for individuals. So just like that infectious agent, the reservoir, we need to make sure that we break the chain by controlling those types of things. And then the next step, or the third step, is it needs somewhere to leave our body. So that's bodily fluids. How do we protect ourselves from that? By proper hand hygiene, disposing of waste, controlling excretions and secretions, and making sure when we're controlling excretions and secretions that we don't forget about appropriate use of PPE, donning and doffing, or putting on and taking off that PPE to make sure that we're doing it as hygienically, according to IPAC, as possible. So what happens next is it needs a way to leave our body. So droplet and airborne are the most common ways that it leaves our body. So a droplet is heavy, and a droplet will drop down, and where it drops, it's still infectious. So when we talk about some disease processes, so C. difficile is one of the disease processes that's in our healthcare community, and C. difficile, those droplets like to live for quite some time. They put a little spore around themselves, and they can live on inanimate objects that you and I would both use as client and support person. So your telephone, your door handles, your utensils in your home. So really important when we're talking about the modes of transmission for C. difficile is that hand hygiene needs to be soap and water, not just alcohol-based hand rubs. An airborne means it's alive. So like I described earlier, when you're doing deep suctioning for somebody in their trach, that's airborne. So we would be using proper PPE and making sure that we've got that N95 mask on. Always, again, trying to keep 6 feet away from anybody who was showing any signs and symptoms of contact droplet or airborne precautions, so we can minimize the risk, and always making sure that we've got a mask on. Once that mode of transmission leaves our body, it needs to get in your body. And how it leaves my body is the same way it gets in your body. So making sure that we keep our hands away from our eyes, our nose, and our mouth, because that's where we transmit the most. If we've got broken skin, we make sure that broken skin is covered up, and we do appropriate hand hygiene and use our proper PPE. And a susceptible host, we used to say, was somebody over the age of 65, somebody who had an acute episode like a burn, a surgery, somebody with a compromised immune system like diabetes, Crohn's, colitis, fibromyalgia, those types of things. We used to say those were susceptible individuals, and or a child who had not yet reached puberty or approximately age 12, because your immune system doesn't fully develop until then. But as we can see with statistics from COVID-19, that people who are young and are healthy, and I think the youngest case that I've read was 8 years old in the US, of a child with no comorbidities, no ongoing health issues, and he died from COVID-19. So how do we break that chain? Immunization. So I know that's a big question with people, and we're going to get to some information about immunizations at the end. So what do we want to do? We want to practice something called routine practices. And routine practices should be followed at all times with all clients. And the biggest one that we talk about is hand hygiene. When you don't have access to soap and water, the World Health Organization says alcohol-based hand rubs, and I'll refer to those in future as ABHRs. Alcohol-based hand rub is an ABHR. Anytime you're coming into contact with an individual's bodily fluids, you must use soap and water, because ABHRs are only good when your hands aren't visibly soiled. If you have an illness, you must act responsibly. So cover your mouth and your nose if coughing. Use a tissue, cough into your elbow, make sure you clean your hands afterwards, and make sure that tissue goes in the garbage. Don't put it on a table, because now the table needs cleaning. Don't sneeze or cough towards an individual. They used to say that you could stay 1 meter or 3 feet away from an individual who was just coughing and sneezing, because the droplets, remember, are heavy and they're going to fall. Now with COVID-19, because everything seems to be a symptom of COVID-19, they're suggesting you stay 6 feet away or 2 meters. Visit your doctor if your symptoms become worse and don't disappear. And again, big stress on frequent hand washing, and do not go to work if you are sick. It is also recommended by the Infection Control and Surveillance Standards Task Force that you have your annual flu shot. And I know some people are not comfortable with that, and that's personal choice, but it is a strong recommendation. So risk assessment. So as I said at the beginning, everybody has their own risk assessment, but what you want to consider if you're trying to think about your own philosophical approach to risk assessment is this. What is the likelihood of exposure to any bodily fluids? The type of bodily fluid that the attendant may come into contact with, the route of potential exposure to infections or microorganisms or germs, the level of risk to the consumer and the attendant, the time it takes to complete an activity that involves potential exposure, and the environment in which the activity is being carried out. So we know that we need fresh air to keep those droplets and particles minimized, and fresh air is a great benefit if we can help that and have that in our environments. And we know that 15 minutes is sort of the window of time that we work with, where we try to limit that less than 6 meters away from somebody in increments of 15 minutes. So what causes the flu and how does it spread? So the flu is a virus. It can live in your nose, your mouth, your eyes, and on your skin. It spreads very easily. There are two main types every year, type A and type B. And what they do when they create the vaccine is they look at the prior year, they look at what's going on in the current year, and they make a vaccine that they hope works. So 2 years ago, the vaccine wasn't as effective as it has been this year. They don't always get it as exact. When somebody has the flu, sneezes, coughs, or talks, those droplets, you should stay 2 meters away from that individual. Work from the side of an individual if at all possible. But remember, droplets can land on those inanimate objects. So it's important to clean those inanimate objects and make sure that, if you pick up the remote from something and your caregivers picked it up and neither one of you had gloves on, now you've both transferred germs from each other. So you want to wash your hands because you might inadvertently scratch your eye, scratch your nose, blow your nose, pick something up and put it in your mouth. And that's a right portal of entry for that bacteria or infection to get in your body. So what is COVID-19? It's transmitted via droplets during close, unprotected contact. Airborne spread has not been documented for COVID-19. So there's, in our country, in Canada, it has not. In other countries, there's 2 that I've heard of, are saying that it does have an airborne component. And when I say airborne, I mean it's living in the air. I'm not talking about AGMPs that I discussed earlier, the aerosol generating medical procedures. They're saying in other countries that it can transfer airborne or droplet, either way. So due to the early stages, and we still, even though it's been a year, we still are in early stages, as we can see with this whole vaccine and our vaccine questions that we're going to talk about later. It's important. So the website is there. It's really important to continue to follow and update your own health information. And there is in the documentation, there is a link to supports for persons with disabilities as well. So physical distancing, what can we do? It can help to stop the spread, absolutely, by keeping that physical and social distancing away from an individual. Avoid crowded places, non-essential gatherings, avoid common greetings such as handshakes, limiting contact with people at high risk like older adults and those in poor health, and of course that 6 feet or 2 meters distancing. Proper hygiene can help reduce the risk of infection. So we want to wash our hands with soap and water or alcohol-based hand rubs until they're dry. Soap and water is approximately 20 seconds, or singing happy birthday twice. And again, alcohol-based ABHRs, you want to make sure that if your hands are visibly soiled, you need to use soap and water to do that. And hand sanitizer, you must continue to rub until your hands are dry. What can we do to clean our environment? So coronaviruses, so the common cold is a type of coronavirus as well. And cleaning is important. So there are a list of cleaning surfaces on the Health Canada website, disinfectants that one can use, but we also have to be very cautious about individuals with allergies to particular types of things that may cause a serious reaction for them. So you'd always want to use whatever is in your client's home, and you can get non-bleach and non-alcohol based products as well. They don't claim to kill COVID-19, but they can play a role in reducing the transfer of those germs. So one way that we've done that in places that I have worked is by using a water and bleach solution. Problem is that there's a type of directions on bleach that asks for the amount of sodium hypochlorite chlorite, sorry, in the bleach. And any bleach I've ever looked at, which is 3 of them, it never tells you. It says it's a trade secret. So we use common bleach when we're making it. And in a hospital setting I've worked at before, what we would do is take 1 cup of tap water. We would take 1 teaspoon of bleach, and we would use that on a surface and clean it appropriately in a well-ventilated area for a 24-hour period. After 24 hours, we would discard that and we would start over again with a new solution. So we just, again, remember bleach the smell, if you've got respiratory issues, bleach can be problematic. Things you want to think about that you need to clean are toilets, toilet handles, phones, electronics, door handles, bedside tables, television remotes, etc. What can we do? We can wear face masks. So medical masks, including surgical or procedure masks, they're called, and N95 masks were in short supply. They aren't as in short supply as they were in the past. What is recommended is wearing a non-medical 3-layer mask now. So we're up to 3-layer masks when somebody is providing care for you. You should wear it in any place that you're going out in the community, stores, shopping malls, public transportation, and it's based on a number of factors when we talk about the type of mask that you should wear. So in Toronto, that is still in lockdown, and we just got out of lockdown in York Region, all of the signage is that you can no longer wear a scarf or a handmade mask, that you must wear a 3-layer mask. So masks come in different types of formulation, but a 3-layer mask that is not called a procedure or surgical mask cannot be equated to a surgical mask. So if you go to Costco or Shoppers or we've got Larry's PPE store here in town where I live, you can't equate that to what we call a surgical procedure mask. So just to give you sort of an idea, when we talk about a level 1 procedure / surgical mask, it has a fluid resistance and it has a filtration efficiency resistance. So a fluid resistance would be as if I was going to put an IV into somebody's arm, if you've ever had intravenous. A level 1 mask would protect me by the 3rd layer closest to my face if something happened and that blood was to splash up and hit the mask. The filtration rate is the second thing that we look at with those types of masks. So in a filtration rate for a level 1 mask, it's 95%. And what it does is it looks at the size of a droplet, and it rates the droplet in something called a micron. So 0.1 microns is what we call the smallest amount of micron that anything less than that could get through the mask. A COVID micron, when we're talking about the size of a COVID micron, is actually 5 microns. So a regular surgical procedure mask that is 3 layers, that is a hospital grade mask, is going to protect you quite well from a particular COVID sized droplet. Hand hygiene, hand washing. Always remember when you're doing it, and we're going to watch some videos, we're going to talk about it. If you've got artificial nails, nail extensions, chipped nails, chipped nail polish, microbes and germs love to find little places to hide in little dusty corners of your hands. So jewelry, artificial nails, any of those things you should not be wearing. Really, best practice is to make sure that you're clean from your elbow down to your fingertips. So jewelry, watches, everything. If you keep it from your elbows down, you won't have spots for those little germs to grow. Make sure the thumbs are some of the areas that when we do hand hygiene spot checks and audits on caregivers, they often don't clean their thumbs appropriately. So the components of good hand washing: you want to turn on the tap to warm temperature, not hot, not cold. You want to wet your hands. You want to use 1 pump of soap. You don't need a ton of soap. If you're using antibacterial soap, remember antibacterial soap is meant to take away bacteria that's got on your hands that got on your hands, urine, feces, blood, etc., mucus. You want to rub your hands together, covering all the surfaces, and what you want to do is create friction. So what I'm doing is I'm rubbing my palms together and I'm interlacing my fingertips, and I'm interlacing them to make sure I get on both sides of my fingertips. Then I'm taking the palm of one hand and I'm placing my fingertips of the opposite hand, and I'm getting all 5 fingertips in the palm of that hand. Then I'm switching and taking the fingertips from the opposite hand and washing those fingertips in the palm of my other hand. And then I'm grabbing my thumb from my opposite hand and I'm washing my entire thumb, both sides, my wrists, my hands. Then I'm going to rinse my hands thoroughly, and everything should always be in a downward motion. You don't want to be doing this up near your face. And then I want to take a paper towel and I want to pat my hands dry. You should not be using reusable towels for anybody in your caregiving circle. They should be using paper towel. What I do when I go out into the community is I have a bunch of old tea towels that my wife goes to throw out, and I'll take one of those tea towels, and while I'm in a client's home, I use that while I'm in the client's home, and then I put it in with my dirty uniforms and wash it and reuse it again once I've washed my dirty uniforms in high temperature wash and high temperature drying. If you have the resources to turn off the tap with paper towel, great, do that. If you don't, then make sure you use alcohol-based hand rubs to clean your hand after touching the taps, because you don't know if those are clean. The World Health Organization says that after you've washed your hands every 10 times, on the 11th time, you should put some good hand cream. So alcohol-based hand rub should be 60 to 90%, depending on the resource that you look at. Some places are 70 to 90%. They do cause irritation and dryness. So again, you want to make sure that you're putting on good hand cream. Apply. So when we're talking about hand hygiene with alcohol-based hand rubs, you want 1.5 to 3 mils. So to give you a visual, a teaspoon is 5 mils. So if you bake and you know the amount of a teaspoon, that's 5 mils. So you're using anywhere from a quarter to a 2/3 of a teaspoon. You rub it in your hands, and you rub your hands the exact same way as you do with soap and water. So your palms together, interlace your fingers on both sides, get your nail beds in your fingertips on your palms, your thumbs, your wrists, and you must do it until your hands are completely dry. And please don't forget that it is only good when your hands aren't visibly soiled. When should an attendant or service provider wash their hands? They should do it at the beginning of every shift before direct contact with the consumer, e.g. your hands touch a client's skin, mucous membranes, especially those at risk, so people on chemotherapy, people with ongoing conditions like diabetes, after you've had direct contact with the consumer, and before you have direct contact with anybody else. When your hands have touched or might have touched inanimate objects, garbage, laundry, bedpans, etc., any bodily fluids, any excretions, and after you go to the bathroom. After blowing your nose, after sneezing, before touching your face, before and after putting on your gloves or PPE. And now what they're recommending is every step of PPE. So the videos that we watch have you only washing your hands, and I'll get to that when I describe it, 2 times when you're doing PPE, and now they're recommending with every step of PPE. And you should not share hand lotion or refill hand lotion containers, because microorganisms like to grow in dark, warm, moist places, and that's not a good idea. So personal protective equipment, where there's gloves, there's gowns, and there's face protection. So John's going to show us 3 different videos, and then all the information is also printed in this PowerPoint. And when I walk through it, I'm just gonna add a couple little things as we walk through.
Okay, I'm gonna stop sharing the PowerPoint and go to the videos. Can you see that, Tim?
Yep.
And I'm gonna make sure that the captioning is on.
Yep.
In full screen.
Check that your hands are visibly clean. If there is obvious soiling, follow the steps for hand washing. Apply 1 to 2 pumps of product to the palms of your dry hand. Rub your hands together, palm to palm. Rub in between and around your fingers. Rub the back of each hand with the palm of your other hand. Rub the fingertips of each hand in your opposite palm. Rub each thumb clasped in the opposite hand. Rub your hands until the product is dry. This will take a minimum of 15 seconds if sufficient product has been used.
So that was how to use a hand rub, and now how to wash your hands properly.
Wet your hands with warm water. Do not use water that is too hot or too cold, as it is hard on your skin and will lead to dryness. Apply liquid or foam soap. Lather the soap and rub your hands palm to palm. In healthcare settings, bar soap should not be used for hand washing because it is easily contaminated. Rub in between and around your fingers. Rub the back of each hand with the palm of your other hand. Rub the fingertips of each hand in your opposite palm. Rub each thumb clasped in your opposite hand. After a minimum of 15 seconds, rinse your hands thoroughly under running water. Be sure that all soap is removed, as soap will dry your skin. Pat your hands dry with paper towel. Rubbing with paper towels can damage your skin. Turn off water using a paper towel to avoid recontaminating your hands. Dispose of the paper towel into a waste container.
And now we'll show the one second. We'll show the other video. On putting PPE, yes, Tim?
Yep.
Perform hand hygiene for 15 seconds. Put on gown. Put on mask. Put on gloves.
And then the final video is taking it off. Oops.
Yep.
1 second, I'm sorry.
Remove gloves. Remove gown. Perform hand hygiene for 15 seconds. It is important to clean your hands after removing gown and gloves to make sure that infectious agents are removed before you touch your face. Remove mask. Perform hand hygiene for 15 seconds. It is important to clean your hands after removing facial protection because they are considered to be contaminated.
And now I'll go back to the PowerPoint.
Awesome. Thanks, John.
Is it back?
Yep, perfect. So there's the links to the video. So when we're talking about, yep, that's great. So next slide. So anytime you're going to be coming into droplet or contact precautions, you want to make sure that you wear the proper PPE. So blood, secretions, someone's got a cold, somebody's coughing, broken skin, cracked skin, you want to make sure that you're protecting yourself and protecting your client. Next. According to the Public Health Agency of Canada, hand hygiene is still one of the highest recommendations and the single most important thing from preventing transmission of germs. So good hand washing technique. So I've already discussed that slide, so I won't go through it again, but the use of gloves is not a substitute for hand washing. So please make sure you wash your hands before and after donning your gloves and taking your gloves off. There's an image here, a visual image, so it shows you how to properly hand wash from Public Health Ontario. For those who are visual learners, next slide. So if you've got a cut in your hand, there are water-based bandages. So if you don't want to wear gloves for everything you're doing, and you don't need to wear gloves because it's expensive for our consumers to purchase all of these, there are waterproof bandages that you can get if you work in a community type of health setting. Tegaderm is a product that we use. So in a facility type of setting, it's just like a fake skin that you can put on over a cut that works great for a 12-hour shift. Remember, artificial nails and chips and nails and anything below your elbows should be taken off and just should be your skin so you can wash appropriately and not transmit germs. Whether you use alcohol-based rubs or soap and water is personal choice, but soap and water must be used if your hands are soiled again, and soap and water is preferred according to the World Health Organization, but we use ABHRs because there's more access to ABHRs. And don't forget, it's that friction, and as you heard in the video and was discussed in the video, you want to make sure you get your complete hands and don't forget your thumbs and the backs. There's an image on how to hand rub from Public Health Ontario, again for our visual learners. The 4 moments of hand hygiene is something that is relevant to any healthcare setting where you're providing support to an individual. Before initial consumer environmental contact, so when I enter your home, I need to wash my hands. Before any procedure where there's risk of exposure to bodily fluids, before putting on my gloves, after exposure to bodily fluids, removing my gloves, and after any consumer environment contact. Because remember, those droplets like to fall, they're big, they fall quickly, but they can live on those environmental surfaces that we all share. All of the PPE listed prevent contact with infectious agents. So gloves protect our hands, gowns or aprons protect our skin or our clothing, masks and respirators protect our mouth and our nose, and goggles protect our eyes, and face shields protect our entire face. Key points about PPE: don before contact with the consumer, and you should do it when you're 6 feet away from the individual. Be careful, you don't want to spread contamination. You want to remove it properly, and I'll walk through that again on a subsequent slide, and immediately perform hand hygiene. So when we put on our PPE, we should wash our hands. The first thing that goes on is our gown. You want to make sure the gown is tied at the neck. You want to make sure the gown is tied at the waist. And you want to make sure the gown at the back has covered appropriately all of your clothing underneath the gown. The gowns that we use that are disposable are made of a same type of fluid resistant material that our masks are made from. So those yellow gowns I'm talking about. And if you make sure you're covered appropriately, then you're going to reduce the risk of transmission. If you're a larger person, and no judgments when I say larger person, but if that gown does not close at the back with at least an inch overlay at the back, you're at risk of transmitting germs onto your clothing, which could go to you, your family, people in public, and other consumers that you care for. So what you would do is you would put a gown on like a house coat first. You would tie that up in the front, and then you would put the gown on properly from the front to back, and that way your whole body is covered. We use goggles or a face shield, and then again, we're washing our hands between every step now is the recommendation from York Region Public Health. Goggles or face shield, wash your hands, and then put on your gloves. So gowns, I just talked about the gown, but there's some images showing you how to put the gown on. And the second picture on the slide with the yellow gown shows that we've got it covered on the back, at least overlapping an inch, to make sure that you're all fully covered. There are reusable gowns that some people have. So reusable multi-use gowns are only meant to be used for one person. If you're buying the appropriate gowns, and there is a reference there on the page, they're made of a tightly woven cotton or polyester material. They're usually chemically finished, and they need to be washed in a high and dried in a high temperature setting, and they should be kept separate in a separate container, and you should only use them for one visit. So you don't want to do a visit then leave it hanging there for 8 hours till you come back for your next visit, because you don't know what's going to happen in between the contamination of that gown. Next.
1 second. I just want to ensure, is the captioning still, are people still seeing the captioning? Rebecca, Rehan?
I am, yeah.
I am as well.
Okay.
So face protection. So disposable masks and eye protection should be worn to protect the mucous membranes of our eyes, our nose, and our mouth during activities likely to generate splashes or bodily fluids. But remember, with COVID-19 or the risk of COVID-19, we're wearing a mask all the time. Disposable masks are not to be shared or washed, and they should be discarded at the end of each day's use. So you can wear one of those 3-layer masks until it becomes moist. As soon as it becomes moist on the inside and you can feel the moisture, and or it has got a splash on it, it's no good anymore, and you need to take it off appropriately by washing your hands first, removing the ear loops with your fingers and dropping it right into the garbage, or undoing the ties at the back as well. The masks are meant to protect our nose and our mouth and should be fully covered and pinched at the nose to make sure that nothing is getting in. Goggles or face shields are meant to protect our eyes. Sometimes what we do is in order to prolong the use of a disposable mask, is if you wear a face shield in front of a disposable mask, you prevent that risk of it getting moisturized more quickly. The anti-fog ones are a whole lot better in my experience, and you can order those from Amazon. So this is a little diagram that talks about the different types of masks. So I talked earlier about procedure or surgical masks that you would buy from a hospital supplier that you may choose to purchase from. So it's about the fluid resistance, and it's about the filtration efficiency. So every level, whether it's a level 1, a level 2, or a level 3, they all have a fluid resistance splash to them, depending on what you're going to need them for. And level 1 would be absolutely fine for your environment. And then the filtration I talked about is that filtration is about getting those little microns that are in. you need to make sure that you have a surgical N95 mask if you're going to do any aerosol generation, like suctioning, CPAP, BiPAP, those types of things. I think I covered all of that. This slide is just talking about the different types of masks again, so I think that's all covered. So when we're putting on our mask, we want to make sure it covers our nose, our mouth, and underneath our chin. We pinch it at the nose to make sure we try to get as much reduction in air transmission as possible. Secure it either with the ties at the back or adjust it with the ties if you've got the ones that are ties, or the elastic ones go over our ears. There are some things that you can buy if you're finding you're wearing your mask for quite some time and your ears are getting sore in the back. Dollar stores have these little plastic things that you attach your mask to, so it rests on the back of your head, and there are little circles, so depending on the size of your head and the space between the elastic at your ears, you just loop it onto those little buttons that are attached to the piece of plastic. Some caregivers that I know have made their own, so they take a little piece of material that's the the distance of the back of their neck, 4 to 6 inches, and they sew some buttons on it, and that way they can wash them, and they're easily reusable, and your ears don't get so sore. So again, we want to change them anytime they become soiled, damp, or damaged. Glove use, when should you wear gloves? Again, any contact with bodily fluids, so incontinence, mouth care, catheter care, bowel routine, suctioning. Remember, when you're doing suctioning, you would need an N95. Do's and don'ts of glove use. So we always work from cleanest to dirtiest. So some of the high touch areas that we talk about. So don't touch your face or adjust your PPE with contaminated gloves. And sadly, I see colleagues of mine who do that. You don't want to be touching environmental surfaces. If something gets itchy and you really can't stand it, you're going to have to take everything off, wash it appropriately, move 6 feet away, scratch what you need to scratch, and start all over again. If your gloves get soiled, if your gloves get torn, even on the same client, you want to make sure that you change them because you're at risk, as is your client that you're caring for. And we want to make sure that they go in the garbage. You should never wash or use ABHR on disposable gloves. The ABHR actually breaks them down. When you're putting on your gloves, you perform hand hygiene first. You don your gloves is the last thing when you're putting on your PPE. The last thing you put on is your gloves. So it's first you put on your gown, then you put on your mask, then you put on your, gown, mask, eyewear, and then your goggles. Your gloves. Extend when you're putting on your gloves and you're wearing a gown, make sure that the glove goes over top of the gown because you don't want your wrists to be exposed. And when you're removing your gloves and you're sliding your fingers, so when you're taking off your first glove, which I think is on the next slide. Sorry, John, I think I'm jumping ahead. Yes, safely remove PPE. So we talk about contaminated and clean when we talk about PPE. So the contaminated side is the outside or the front. So when we're talking about taking off our PPE, we want to make sure that we try to have as minimal contact with the dirty parts as possible. So the clean part is the inside. When we talk about PPE, the outside of the back, the ties on the head and the neck, areas of PPE that have probably not come into contact with an individual. The contaminated is the part that's come in direct contact. So your gloves, the outside of your gown, for example, is where all those germs are going to be hiding. So when we take off our PPE, the first thing we do is we remove our gloves. So you got both your gloves on, both your hands have gloves on. You take your fingertips from one hand and you grab at the palm, not near your wrist, but the palm of your hand. You grab the glove snugly and you pull it straight off. You roll that glove up into the glove you just took off. You roll it up into the glove that's still on your opposite hand that you used to remove that glove. And then you slide 2 fingers or 1 finger between where your glove is over top of your gown, or if you're not wearing a gown, between your glove and your skin on your wrist, and you roll that dirty part of the glove because your hands are on the inside of your glove now, not on the outside, and you roll it over to make sure that both of the gloves are tied into one little bundle. And that way you're minimizing touching the outside of it. You then wash your hands. You remove your gown. You untie it at the back, you untie it at the neck, and what you're trying to do is just roll it off of your shoulders, because remember, you cleaned your hands, you touch the ties, which are minimally dirty, you rolled off that tie, and then what you want to do is grab it from the inside and pull it off of both of your arms and roll it up in a nice tight ball and drop it into the garbage. You're going to wash your hands again. And then you're going to take off your eye protection, which could be a face shield or a pair of goggles, wash your hands again. Then you're going to take off your mask and wash your hands again. So this picture is a good image for those of you who can see it, is where I was talking about by making sure that you pull that glove from the middle. You don't want to be touching anywhere near your skin. So that's just images of how you take off your gown, so you can see exactly as I described. The person's undoing the ties, they're rolling the gown forward, and they're trying to touch the inside of the gown with their cleaned hands to make sure that they roll it from the inside out to keep all those germs on the inside. And again, all the hand hygiene that I talked about. Environmental controls. So as support staff, we want to make sure we clean and sanitize common areas. So use appropriate washing products and dedicated hand washing sinks when you're providing care and support to an individual. So we don't want to be washing our hands in their kitchen sink where we're preparing their food, for example. Some general cleaning guidelines. Cleaning products can cause harm if they're not used and stored appropriately. And if you're going to make that Javex water Javex bleach that I talked about, please make sure that you label it and date it so it's got a label and nobody's going to mix it up and try to drink it or do something different with it. We always clean from highest to lowest, work from the farthest to the closest, work from dry and then to wet, and work from the cleanest to the dirtiest. Change your cleaning cloths and your water frequently. When you're dusting, because dust has lots of particles and bacterium in it, you want to use a damp cloth for dusting, and rinse and dry those washed surfaces that you've used heavy bleaches on. According to Public Health, they recommend the following for environmental cleaning during self-isolation. So for COVID-19, clean and disinfect all frequently touched surfaces in your home, including bathroom and toilet surfaces, at least once per day and when contaminated with respiratory secretions, and more frequently if needed to be. Use cleaning products provided by the consumer, and please be aware of those with sensitivity. So they make ones that do exact same job. They're more expensive typically, but they do the same job that don't have harsh chemicals in them. So vaccinations are proven to prevent serious communicable illnesses. Healthcare agencies require workers to have routine vaccinations. So there are some questions about vaccinations. There's some references here that John has put in the PowerPoint on slide number 71 for you about the vaccine rollout. When can I expect my vaccine? And I'm not sure, John, sorry, I forgot to ask you, are you going to play that Science in 5 video, or do you just want me to talk about it and people can play it on their own?
You could talk about it.
Okay, so I'll talk about it in the Q&A because it's more relevant to the Q&A.
Okay.
Summary of key points. Good hand hygiene, as we know, is the most important method for preventing germs. Stay at home if you're ill. Receive notification from your consumer or employer. Stay home. Use routine practices, so that's hand hygiene and personal protective equipment, and all visits for precautions for your clients and yourself. Good nutrition, hydration, exercise, sleep. Keep your immunizations up to date and get your flu shot. Infection prevention and control includes all actions used to prevent or reduce the risk of transmissions or microorganisms. And again, it's about prevention. Microorganisms are small. You can't see them. They're invisible to your naked eye. So really, really important. I like to use the analogy of the Titanic movie. So, you know, all they saw was a very small iceberg. They didn't see what was underneath it. And that's really what caused the damage and people's death from sinking of the Titanic. We don't want to be sinking from COVID-19 because we think getting together with a couple of people, taking off our masks if we have a couple of drinks and forget about it. So we just really, really want to be cautious to follow public health guidelines. Bacteria, viruses, and fungi are some of the germs that we talk about. Microorganisms can cause infections with other people who are well and other people, especially who are not unwell. They live on environments. Remember, some people are asymptomatic, or they're colonized but don't show any signs or symptoms. So we need to really treat everybody like we're potentially ill. The chain of infection, remember those 6 steps? That chain won't stay together if you break one of those steps. So all you got to do is remember one of those steps and maybe really keep up to date with infection prevention and control and check in with your own public health. Every public health agency, in my experience, does things a little bit differently. So really good to check in with them.
So now this is question and answer period, and people can put their questions in the chat box. We also have a list of questions that people submitted, and Tim will be answering them, and Rebecca will be the one posing the questions anonymously. And after the Q&A, the last 10 minutes, we'll be discussing the resources that we're going to be sharing and a evaluation poll. If people could stay, that's the only way we can improve these workshops. So I'll ask Rebecca to ask the first question to Tim.
Great, Tim, we have a question about the N95 masks, and the question is, can you reuse that mask? And if yes, how many times can you wear the N95?
So best practice is that an N95 mask should be used for an activity and discarded afterwards. During the first wave, we were not doing that because we didn't have access to N95 masks. So what we were doing was washing our hands, taking them off, having them face up between 2 paper towels, but that is not best practice. That is something that you do in a crisis situation when you don't have appropriate PPE. So in the community now, in both of my jobs, so one is in a hospice where I'm a nurse and the other is in a hospital, we don't reuse anything anymore.
Great, thank you. There's a question about, there's been a lot of information lately about double masking and whether going out in the world or if we should be double masking, and if so, when we might want to double mask.
So I'm assuming the person is talking about, should I wear a cloth mask and a 3-layer mask together? I'm assuming that's what they mean by double masking. So there is no study information that I'm aware of, and maybe somebody else online knows, where double masking is recommended. So again, I'll go back to the first wave. In order to preserve our regular level 1 mask and our N95s, what we did was we wore our N95s over our level 1 masks in order to preserve them. So we weren't constantly taking off, and we're trying to minimize, remember, minimal risk, predictable outcome. By taking off my regular mask and putting on the N95 and then switching them, I'm touching my face a lot more. I'm leaving that mask exposed a lot more. So did we do it? Yes, because we had to, but it's not something that would be considered a requirement or best practice. If you've got a 3-layer mask or a filtered mask and you're in general population going out to do shopping, what they're saying, and you should check always it's like the toronto.ca COVID-19 website or COVID-19 Ontario always has the most up-to-date information because things change. This is ever evolving, but I have not seen anything about the need for double masking, just making sure you've got a 3-layered mask.
Okay, great, thank you. And then there's another question about double masking, that if you are wearing 2 masks, can you reuse one or either of them?
So again, just in my clinical opinion as a nurse, putting on 2 masks is like putting on 2 pairs of gloves. You're going to contaminate things, and you're going to give yourself, in my clinical opinion, a separate sense of false security. So it's not something that I would recommend. Studies that have been done on surgeons who double glove, 50% double glove and 50% didn't double glove, and they found no difference in the outcomes for the reducing the risk of transmission using surgical gloves, those who double glove to those who didn't double glove.
That's very interesting. Could you quickly tell us the difference between an N95 mask and a KN95?
So an N95 mask is a mask that is produced specifically to ensure that you're not going to get aerosol generation. So a KN95 that we see out in the community by people that are producing them, you would have to make sure that that KN95 is from a producer that is producing a hospital grade N95 mask. So we are going there, according to the federal government, we have a factory in Quebec that by the end of this calendar year will be producing KN95 masks and N95 masks that are at that level. But my understanding is the KN95 masks now are the knockoff masks, and they would not be giving you that same aerosol generating medical procedure, because you need to be mask fit tested and you would be assigned a particular mask, and a KN95 is not currently one of those.
Okay, so the N95s are the kind of recommended masks that most of us would be looking for.
Right, and they're different sizes, right? So they're, I happen to be an 8210, for example, and I was an N82 for years, and now all of a sudden I've gone to a smaller in my last mask fit testing a year ago. So you need to be mask fit tested every 2 years if you lose or gain 15 pounds, if you have dental surgery, or if you grow facial hair.
And is that mask fit testing for the KN95s or both? N95s.
Yeah, KN95s aren't one of the masks that you can get mask fit tested for.
I see. Thank you.
This is John. Just as a follow-up, N95 masks should be used. I mean, if a PSW is going to a consumer, not every consumer or service provider has N95 masks. Is a triple layer mask okay? Or is
an N95 is only for aerosol generating medical procedures, or AGMPs. So deep suctioning, if you're deep suctioning somebody orally, if you're doing trach suctioning. There was a reference, John, in our last 2 sessions that we did about what AGMPs actually are. But again, I would encourage you to look at your local public health website or covid19toronto.ca, because they will have a list of AGMPs that are considered that you need an N95 for. So just regular care, when I'm not doing anything like that, you just need a regular 3-layer mask.
Okay, thank you.
You're welcome.
Thanks, Tim. Earlier, you mentioned that people with burns can be more susceptible to exposure. Does this mean live burns as opposed to ones that have healed and left scar tissue behind?
Yeah, so I'm talking about somebody who's got so the larger the burn, so you lose the inability of your body to regulate your body temperature. So it makes you immunocompromised from that perspective, and it's a right portal of entry for infection as well. Once you have scar tissue and it's healed over, that skin is more susceptible to injury, because scar tissue isn't as vascular as our regular tissue, and depending on the depth and layers of the burn that you've actually had, it makes the tissue more susceptible. But once it's closed over, no.
Great,
Once
thank
it's
you.
healed, I should say.
What is the best protocol to follow if staff need to eat or drink while they're in a client's home?
So again, 6 feet, you want to be 6 feet away from the individual. I would suggest that that person cleans the area where they're going to sit and eat, and is very aware of the things they're touching, because now I've got my mask off. If I cough, if I sneeze, you can cough and sneeze up to 3 feet approximately. So I would want to make sure that when I'm done, for the consumer's safety, that I clean all that area and everything that I touch, because you're obviously not going to be wearing gloves while you're eating your sandwich or drinking your coffee. So you want to make sure you clean the area well afterwards to make sure you haven't left any droplets that are going to make someone else ill.
Thank you. And I have a specific mask question. This individual says, I have a quantum with a fan inside my mask. Does this prevent COVID-19?
Wow, I have no idea. I don't know what that is, a quantum with a fan inside of it. So I don't know if anybody online does. I'd have to research that. I'm sorry, I don't know. It's called a quantum with a fan? Quantum with a fan?
Yes.
I have no idea what that is.
We
Sorry.
can do a follow-up later on if we can find any information on that.
Yeah, John, I'll put it on my list for you for us if you want me to research it.
Yeah, thank you.
Okay.
There's a question about if a caregiver tests positive from COVID-19, are there any increased measures that need to take place? And the second part of the question is, if you find out a caregiver has tested positive, is there a way for rapid home testing to happen for the self-manager?
So that the rapid tests are given specific to specific organizations, so they're not out in the public from my understanding at this point. So you could contact public health to see if you could get access to one. I know that we have a lot, and I know that I heard on the news today that a bunch of them are going to be expiring because they haven't been used as readily. So that would be an option, is contacting your local public health to see if you could get access to them. So there are guidance documents for community workers, and the guidance document for a community worker says that if you have gone for a COVID test because you have a close proximity, and it all depends on the agency. So self-managers are their own agency. So I'm assuming I'm going to go by the fact that they're in the community. So what would happen is the individual, if they're not showing any signs or symptoms, but they've had a close contact and have gone for a test, as long as they wear full PPE, so that's gown, mask, goggles, gloves, and they're allowed to work. And if that test comes back positive, then they need to self-isolate for 14 days and be retested. That was the initial guideline. So that's still the same in long-term care. But once you have a positive test, you still need to self-isolate for 14 days.
Great, thank you. There's another question. Oh, and it's just disappeared now. Here it is. So early on in COVID, there was talk about and patterns on how to make safe fabric masks that talked about tight woven material and using something like silk. So there are these 3-layer fabric homemade masks out and about. Are these masks safe to use?
So what they're saying now is that you should be using a 3-layer procedure surgical mask, and because of the 3 variants that are out there and the increase in the variants, and I mean Toronto's had significant increase in our school system with one of the particular variants, that I think 11 schools now are showing infection of the variants. So again, because it's ever evolving and things are changing, what I'm reading from that is that we should be using the disposable masks. Now, for caregiving, because you're in intimate personal spaces, people are still wearing some 3-layer masks out in public, but most, if not all, in our region, in York region, you can't go into a store without a disposable 3-layer mask on. They're not accepting regular cloth masks.
Thanks, Tim. Yes, sometimes it's hard now that we've all purchased a bunch of different fabric masks to go back and make sure which ones are 3-layer and which ones are not.
Exactly.
This may be a question for Lisa in direct funding. And I'm not sure if you are around and available, but the question was, is CILT able to provide self-managers with masks and PPE?
Great question, Rebecca. So CILT, so on the direct funding program, the program has funded self-managers to purchase PPE. And in situations where we're not really equipped to ship PPE out to all self-managers across the province, but in situations of emergency, if, for example, somebody runs into a situation with somebody that's positive of COVID and needs access to gowns or face shields, something like that, we can certainly ship to individuals that need it. But for the most part, we're hoping that folks are using the COVID funding that they have received to purchase the necessary PPE.
Thank you, Lisa. There are some vaccine-related questions. John, did you want to shift into that piece now?
Sure, if all the other questions have been asked.
Yes, and if anybody has other questions that pop up, please put them in the chat and I can follow up if there's any more that comes up as you're processing all of this information.
Do you want to go ahead and ask?
Sure. I wasn't sure if somebody had pieces to say, and I know Lisa may have some things to add. This is a more general question that Tim might be able to answer. If you get the COVID vaccine and you have a reaction or symptoms that come up, can you infect others?
So good question. So there's a video that's in the link. It's the World Health Organization video. And I would encourage anybody to, it's called Science in 5. If you Google the World Health Organization Science in 5, they've got great videos to help individuals. And John put it here in the actual PowerPoint for you. And again, what it says is it's ever evolving. So there are shades of gray, just like with all our politicians that we're listening to. And there isn't enough statistics. So we don't actually have enough data, according to the World Health Organization, to answer those types of questions. What they say is, once you get the first injection of the Moderna or the Pfizer, within approximately 2 weeks, you've got a significant amount of immunity. They don't say the percentage, but they say a significant amount of antibodies have been produced. And then within 21 to 28 days after that, you get your second dose. And what you're doing is getting, again, an increased amount, but they don't give the exact details of the increased amount. What they say is that we still need to follow everything we're currently doing until we hit that percentage, that what's called herd immunity. If people heard that term, is the percentage of individuals who actually get them in the population. And I'm seeing anywhere in things I've read, 60 to 80% of people need to be vaccinated in order to reach herd immunity. But again, this is new, remember? So we won't know until they have more time to study it. And the herd immunity, for example, oh gosh, now I've forgotten, it's not 95%, I think, for rubella. So in order to prevent a rubella pandemic, 95% of people need to be vaccinated, for example. So every sort of vaccination protocol is different depending on the virus. I hope that answered your question.
Thanks, Tim. I know, Lisa, you have to leave. Did you have anything you wanted to add before you head off?
I think it's okay unless there's any other specific questions that relate to direct funding. And Leanne is also on the call, so she can add into the chat if there's any specific questions.
Perfect. The only specific questions are, how will we be prioritized? Will people with disabilities be prioritized for the vaccine? And if so, how will we be contacted?
So for self-managers, so we know, for example, that in the Toronto area, individuals with disabilities are not currently being prioritized. Healthcare workers are being prioritized first. But we do know in areas outside of Toronto itself that pre-registration is available for individuals with disabilities as well as healthcare workers. They don't seem to be prioritizing one over the other. Everybody's allowed to pre-register at the same time. That doesn't mean that once you're registered in the category that you sit, that healthcare workers might be prioritized above you, but they are all pre-registering at the same time.
Interesting.
And we are, by the way, we are in contact with the public health units. The direct funding program is in contact with the public health units across the province to try and find out when everything is being opened. And attendance on the direct funding program should have a letter from the program itself, because they don't have any identification going in that they are a healthcare worker, which is supposed to be the highest priority. And so the CILT and the direct funding program are putting a letter on letterhead for all attendants, and self-managers are being given a link so that they can provide us with their attendance information, and then we are preparing the letter and sending it back to both the attendants and the self-managers.
Lisa, I have one question that's in the Q&A, and that is, they're asking, when posting to hire, what can I ask them? For example, negative COVID test, or a promise to get the COVID vaccine when available. Are they able to ask these questions?
We're actually just exploring the legality of that, actually, John. We have actually asked an opinion from our legal counsel. We also are asking other individuals in the attendance service world what they are doing. We understand from a call that we were just on, actually, that education, vaccine hesitancy education is key. And so we are looking at finding ways for self-managers and attendants on the program to become better educated about the vaccines, about the safety of the vaccines. And we are looking into, that is one thing that we're looking into to try and avoid some of the vaccine hesitancy that we're seeing. But we don't have a legal opinion right now on what you can say to an attendant that refuses to vaccinate.
Thank you, Lisa.
Thanks, Lisa.
And I'm very sorry, guys. I have to run. So sorry.
No problem. Thank you so much for joining us.
Bye, everybody. Thanks, Tim.
Nice to see you.
What I will do is I will make Leanne a panelist. During that time, you can ask the next question, Rebecca.
Great. We have someone joining us on the phone who would like to ask a question. So the person with your hand raised, I'm going to allow you to talk to ask your question, but we're keeping the Q&A piece anonymous. So please do not say your name or identifying information, and that way when we send out the recording, you won't be identified. So. Okay, you should be able to go ahead now.
Sorry, I just would like to find out in regards to the masks that we make ourselves, if it's a triple layer, is that okay? Because some people cannot afford to keep buying the disposable masks.
So the public, to get the definitive answer, you'd have to check with your own local public health. But most public health that I work within, which is Toronto and York region, are saying that you need to have disposable 3-layer mask for caregiving. Not
for caregiving, but for the public.
Yeah, you can still wear them out in the public. You may find some stores won't allow you in, or some, if you go to a medical office for a test, for example, but they are providing the disposable mask when you arrive. So if you go to your doctor's office or you need a CAT scan or blood work and you don't have one, they're actually giving you one. But some stores, as I understand, are not allowing people to come in without a proper mask.
Okay, thank you.
You're welcome.
Thank you. Tim, once somebody is vaccinated, what kind of PPE practice post-vaccine do they need to follow?
So Great question. So the World Health Organization is still saying that you still need to do everything exactly the same because we don't have enough of statistics and data, and we don't have enough people immunized at this point. So even though you've had the shot, you still need to continue. And again, we're just getting research, right, from the shots that have been given. We're just starting to formulate research. So everything is status quo with your injections.
Great, thank you. I see some comments. Don't worry, I have not lost your questions. There are just a lot of questions coming in, so I'm bouncing around to make sure that I can get to as many as possible. So there's a specific question about the Pfizer vaccine. And the question is this considered safe against variants? And if later on it's found out that it is not considered safe, is this the kind of thing where there could be a booster or something else to protect against the variants if you have received the Pfizer vaccine?
So I can answer the second part of the question. The first part, I don't know. The second part of the question is that they're looking at creating boosters now for the 3 variants that are out there. And I don't know the definitive answer to the first question. Sorry, if it's, if Pfizer is, I think the first, what they call the UK variant, but I'm not 100%. But if you went onto the Pfizer website, they would be able to give you that information.
Great. And I'll mention to attendees that we're also talking about having a workshop that is specifically about vaccines, because there's obviously a lot of information that we need to make sure our community is aware of. Tim, do you know if once people are eligible for the vaccine, is it possible to have a choice of which one you get? Or when you're eligible, do you just kind of get what you get?
Great question. So I can only go on my personal experience. So I'm on 2 lists, and both of those lists are either Pfizer or Moderna, but I have not made it yet to be picked from those lists as a healthcare provider. And you get whatever vaccine they have, is what I was told.
Great. Thank you, Tim. And I know there's some conversations that it's always good to, if you have allergies, to check in with your doctor about components of the vaccine.
Yeah, because there's a screening form. So when you get notification, and we don't know, as Leanne said, each of the 34 public health are responsible across the province for setting up their own notification system and their signing up system. And I understand Simcoe Muskoka, so if you have direct funders in Simcoe Muskoka, those they've actually got their website up. The Simcoe Muskoka one is actually public health unit in Simcoe Muskoka has got their COVID information up, and you can actually start to access and reference that, which is sort of Barrie and sort of north of Barrie, Aurelia, and those types of areas. But the accessibility piece and my understanding is everybody has to fill out that pre-question, because if there are questions, then you need to speak to your healthcare practitioner, because they don't give you, they're just there to give you the injection. They're not there to, and monitor you, obviously. But if something happens, they tell you to go back to your practitioner or the emergency room if you do happen to have a response, but they're not there to decipher. So they give you a Q&A, so that triggers you then to call your healthcare practitioner.
Great. Yes, I'm sure we will have more and more information as all of this unfolds. There's a question about if you are not able to wear a mask, do you have any recommendations for individuals who are not able to wear a mask, what best practices might be?
So I would definitely want to make sure that the caregivers are wearing their masks. If you can have a window open while you have caregivers there, I don't know if that's at all possible. Fresh air helps to keep things circulating. and really, really good hygiene practices with all your caregivers. That's all I would. Could they wear a face shield at all? A face shield doesn't cover your nose and your mouth, but that might, it certainly wouldn't hurt.
Yeah, that might be something to try for sure. So there's a question that may be something we follow up later, but can employers move workers up on COVID-19 immunizations list because they are working in a medical home situation?
Well, the current vaccination in this first phase is on the reference that John put on the COVID-19 Ontario vaccine reference. And anybody who is a healthcare provider is considered in that first initial rollout in phase 1. So if you're caring for an individual out in the community, the long-term care, retirement, congregate settings were first. I think that's where Leanne was saying she's provided a letter for your direct funders so that they can prove that they're a priority.
Yes, that was Lisa who left. Leanne is here,
Sure.
and I'm wondering if Leanne, if you have any comments on that, if there's a way for self-managers to make sure that their employees are put on the immunization lists.
Hi, Rebecca. Can you hear me okay?
Yes, thank you.
So I don't know of anything like that. We're dealing with each public health unit as they advise us that the names of, or that our consumers are eligible for the vaccination rollout. So we are dealing with each of the units as they make that information available. So I don't know of any way that you can sign up in that fashion that this person's asking about, I think, if I understand the question correctly.
Great, thank you. I think that makes sense. Tim, given some of the vaccine hesitancy among members of some racialized groups, can you comment on how or whether any of the existing vaccines have ingredients, for chemical ingredients that have been known to pose risks based on things like a person's genetics?
I don't, sorry. In any vaccination, they do a Q&A, so they get a history and they'll ask you specific questions. And at that time, I believe it would be your medical practitioner, is my understanding from my own personal experience. You have to go back, because I had that experience and I needed a question answered. And when I emailed them directly, because the link, you fill out a questionnaire, you get your name put on the list as a frontline worker, and then if there's a email address in the notification. If you have any specific questions, please ask us here. And because mine was exactly one of those questions you just described, Rebecca, they said you need to talk to your healthcare practitioner. So I can't imagine that's going to change, because their job is just the rollout, is to make sure everybody gets vaccinated, and they're desperately looking for nurses, I understand, to get ready for our big phase 2 and phase 3.
There is one, actually, what I would like to do, there's about 15 minutes left. I'd like to get through the resources and the evaluations, and if there's still some time at the end, we'll continue asking any additional questions. And so we're going to move on to the resource section here. And Tim has put together a list of infection control websites that will be part of a handout that I'm going to be emailing everyone. I'll be emailing this PowerPoint plus additional Word document that has all these web links that you could get more information about infection prevention control. The reason why infection prevention control, and Tim has stated this, is that we still need you to continue to do proper infection prevention control, even though vaccines are on their way. With the variants being out there, we need to continue to practice, hand hygiene, social distancing, the proper PPE for our attendants, and doing the things that are necessary to protect ourselves, even when we get vaccinated. So I just wanted to state the importance of these type of workshops, because we still need to do these things to keep us safe. So so here are a number of both Canadian from Health Canada, the provincial, and how to use isolation gowns for more information. And as Tim was mentioning, the Public Health Agency of Canada is the main link for the Canadian, to get Canadian information for across the country. And then Public Health Ontario, the website is here and will be attached in a Word document. And they also have excellent online learning, where I showed you those videos, where you can watch those videos and show it to, or either watch it for yourself, your family, or your PSWs. And there's also IPAC Canada, and also in the US, the CDC guidance on using PPE. So there's also information on medical masks and respirators, and the 4 moments that Tim was talking about, medical masks, and the World Health Organization and their link there. So there's a number of resources here that people can get more information on what they want to get more information about. And I want to actually go to this slide here, where we put together a small list of where you can get PPE. The Ontario government has this website, Workplace PPE Supplier Directory. And if you go there, they list a whole bunch of different PPE suppliers from across Ontario that sell personal protective equipment. And then Direct Funding has created a Word document that's been consumer validated, but it's more of a general place where people can go and get PPE and other supplies. And that link is here and will be shared with all the participants who've signed up. There's also some other consumer validated places like Starkman Medical Supplies in Toronto, as well as Maxwell Express, Great Canadian Supplies, and Northern Surgical Medical. Some of these places have websites and email addresses, and some are just phone numbers where you have to call to order. It's important as a disclaimer that any listings compiled by CILT or Tim or the government is for information purposes only, and CILT does not recommend or endorse any of the companies. So you have to kind of do the research. But these are some of the companies that offer these type of PPE and gloves and things that people can use. So with regards to the resources, they're going to be sent out to everyone. A copy of this PowerPoint, the PPE resources that I've just listed and their links, and also this Zoom recording. I will be sending an email to everyone probably within 24 hours because it takes time for the Zoom recording to be uploaded. And what I wanted to do was go to our Zoom poll evaluation questions. And I want to thank everybody for your time and participation. If we still have time at the end, we'll continue asking questions. But I thought that we get to the poll evaluation questions so that we can improve our workshop, future workshops. And I'll let Rebecca do the poll.
Great. I am launching the first poll. So if everyone can click to select their answer and then down at the bottom hit submit, that would be great. I'll let it be open for a minute to give everyone a chance. And I apologize to those of you joining over the phone. The polls are not a phone-friendly activity. So I'll just give it a few more seconds. We've got about half of the people with us who've answered.
And this is anonymous. Once again, these polls are anonymous.
Yes, thank you, John. I forgot to mention that. All right. So I'm gonna end the poll in 5, 4, 3. Don't forget to hit submit. 2, 1. Great. And here's our next question. Did the workshop expand your knowledge of infection prevention and control? So please select your answer. And we'll just give it a little bit longer. We've got almost everybody responding. Great, and don't forget to hit submit. I'll be closing the poll in 5, 4, 3, 2, 1. Great. Our next question. Do you feel more confident using IPAC practices to reduce your risk of exposure in your daily life? And I'll just give it a few more seconds. I'll end the poll in 5, 4, 3, 2, 1. And 2 more questions. Thank you so much, everybody, for taking the time to answer. Was the information today easy to follow? Great, and I'm going to close the poll in 5, 4, 3, 2, 1. And last question. Were the resources presented today useful? And I'll just give everyone a few more seconds. And I'll close the poll in 5, 4, 3, 2, 1. Thank you so much, everyone, for taking the time to answer those evaluation questions. And I'll hand it back to you, John.
Thank you very much, Rebecca. So I'm gonna end the poll here, Rebecca.
Pardon?
I'm just going to close it.
Yes, if it is still open on your screens, you can just close it with the little X in the top corner.
So in the PowerPoint, you'll have our contact information at CILT, as well as Timothy's contact as well. And I know that we have maybe just a couple of more minutes left. I don't know if you have any other outstanding questions, Rebecca, that we can ask Tim before we finish at 3. I want to thank everybody once again for participating, and we really appreciate your feedback.
Rebecca, can I just add one thing, just in case, I'm not sure, because now I'm forgetting what we all talked about, but I think one of the questions was related to, can direct funder staff have access to the vaccine now? I think that was a question. So they are a priority as caregivers. So I just want to make sure that that was clear. And I mean, we still have to wait until the access is there in that area, but they are a priority. And the document, it's called the Ministry of Health's Guidance on Healthcare Workers Prioritization. It's a PDF document. So if you Google Ministry of Health's plural, Guidance on Healthcare Workers Prioritization, and you click on it, it actually has direct frontline workers. So they would have access as soon as it's available in the first priority wave. So in our region, when it opened up, direct frontline workers and PSWs could get it, but there are nurses like me who, I mean, the volume of people and the amount of vaccine doesn't match, obviously. And I don't know if you had any other questions people wanted answers to, if we got a minute or so left.
Thanks, Tim. I mean, we're running out of time, but there was a question. Oh, there's one that just came in about how to get on the list for vaccinations. So this person is specifically saying, how do I get myself on the list because of my poor immunity, so being immunocompromised?
So I would contact my healthcare practitioner, because maybe they could escalate it for you, and your public health wherever you live. So again, the only place I know that actually has it posted currently is Simcoe Muskoka Public Health. They've actually got all their information up and your ability to log on and sign up for any of the phases, but I don't know of any of the other 33 public healths that are ready yet to do it, because I think it's 3 more weeks till we get our big amount of vaccine, and we still have in phase 1 lots of people who are waiting to be immunized in the phase 1. I know that it's not hopeful, but hopefully it helps you a little bit.
Yes, and as I mentioned before, stay tuned, because we're talking about how we can put on another webinar like this specifically about vaccines as more and more of this information becomes available and we learn more and more about how what the rollout is going to look like in different communities.
So that being said, once again, thank you, Tim. Thank you, Rebecca. Thank you, everyone, for joining us. Thank you to Leanne and Lisa from Direct Funding. We also thank our funders that have provided this funding to help us provide education and both IPAC for people with disabilities. It's part of trying to keep ourselves safe, especially now with the new variants, and still needing to do IPAC practices even when we get our vaccines. So thank you once again, and I'm going to stop sharing the screen now and end the webinar. Thank you, everyone.
Take care, everybody.
Bye.